Thank you for tuning into Northpoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by Northpoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today's guests are Wendy Nelson and Dr. Helen Thomas. Wendy has been a nurse for the last 20 years. She graduated with her master's degree in leadership and administration and education from Capella University in 2019. She began her nursing career working in the medical, surgical, and ICU departments, where she developed a passion for caring for those with mental illness and chemical dependency. She has been in that field of nursing for the past 9 years. Wendy also has worked in detox, corrections, and volunteered for the unhoused. She strongly believes in integrative care and holistic nursing. Dr. Helen Thomas is a family physician who has been at Northpoint for 4 years. She loves to take care of her patients from 0 to 100 and has special interests in prenatal care, addiction medicine, LGBTQIA+ care, and health at every size. She went to undergrad at Macalester College, my alma mater, then medical school at Michigan State University, followed by residency at the University of Minnesota. So we'll welcome Wendy Nelson and Dr. Helen Thomas. Thank you for joining us.
Thank you.
Hello. Thank you so much for joining us and for being willing to have this conversation and answer our questions. This is a topic that's incredibly important and sometimes maybe a little difficult to talk about. So we're so grateful to have you here to answer our questions.
Thank you.
Yeah, we're glad to be here.
Great. All right, let's just jump in. My first question for Dr. Thomas, we're talking about alcohol awareness. And so tell us the very basic scientific process behind what makes a beverage an alcoholic beverage.
Yeah, so an alcoholic beverage has the molecule ethanol in it, which is traditionally formed by fermentation.
Mm-hmm.
That molecule is very easily absorbed by our body. Actually, when we consume an alcoholic beverage, within 30 seconds, that molecule of ethanol, which is really small and easily translates through our stomach and gut wall, can get to the brain right away. And then that molecule, the way that it affects us is actually by interfering with how our brain cells communicate with each other. So the ethanol molecule prevents neurotransmitters, which are kind of little messages between our brain cells, from effectively working, basically. And so it starts to basically prevent our brain cells from communicating with each other. And that's how alcohol affects our body in the brain.
Talking about alcoholism and addiction, Wendy, can you provide a definition for alcoholism for us?
Yeah, so alcoholism is really based off of what we call the DSM-5. So there's different criteria that are used to determine whether or not someone has what we call an alcohol use disorder. There are a number of questions, and they are categorized by either mild, moderate, or severe alcohol use disorder. So some of the questions that asks are, how often is alcohol taken? Is it taken in large amounts over a longer period than was intended? The next one is there a persistent desire or unsuccessful efforts to cut down in the control of alcohol use? The next one is a great deal of time is spent in activities to obtain alcohol use or recover from the effects of alcohol. The next one is, are there cravings or a strong desire or urge to use alcohol? The next one is recurrent alcohol use resulting in failure to fulfill major role obligations like work, school, or home life. And then is there a continued use despite having persistent or reoccurrent social or interpersonal problems caused or exacerbated by the effects of alcohol? Oftentimes that's relationships with maybe a spouse or family, or maybe at work having difficulty there. The next one is important social, occupational, or recreational activities are given up or reduced because of the alcohol use. Number 8 is reoccurrent alcohol use in situations which is physically dangerous, so like driving or doing high-risk behaviors. And then alcohol use is continued despite knowledge of having persistent or recurrent or psychological problems that is likely to have been caused or exacerbated by alcohol. And then there's tolerance. So we do build up a tolerance to alcohol, basically meaning that you need more and more of the substance in order to feel the effects of the alcohol. So if there is an increased tolerance level and a need for a markedly increased amount of alcohol to achieve that intoxication or desired effect. Or a diminished effect of alcohol despite the continued use of the same amount of alcohol previously consumed. So the last one then would be withdrawal, and that is when you're starting to feel the physical and psychological effects from ceasing the alcohol use. So you may have tremors, sweats, irritability, anxiety. In severe cases, you may even have a seizure from stopping the alcohol, which makes alcohol withdrawal pretty serious and oftentimes will require some hospitalization, IV fluids, and some close monitoring to be sure that the alcohol withdrawal is done safely. So if you have 2 to 3 of these, then you would be in a mild alcohol use. If you have 3 to 4, or excuse me, 4 to 5, we would consider that moderate alcohol use. And if you have 6 or more, you would be considered having a severe alcohol use disorder. Any one of these could it mean that you would want to seek out treatment from your provider and kind of see what your options are. There are several different treatment options available.
Dr. Thomas, can you tell us about the adverse side effects of drinking alcohol in excess?
Yeah, so a lot of the diagnostic criteria for alcohol use disorder kind of touch on that. But alcohol use is not good for your health beyond the recommended amounts, maximum recommended amounts. But cancer is something with heavy alcohol use, increased risk of several different kinds of cancer, heart disease, high blood pressure, stroke, obviously injuries like Wendy talked about when you're driving, using alcohol or doing other, when you're having alcohol gives you inhibition. It gives you a lack of judgment, and so you're more likely to put yourself in a dangerous physical situation and become injured physically. Also increases risk of suicide, which is something to know about people in your family. If they are having mental health problems and they're drinking, it's definitely important for you to touch base with them about their mental health problems and make sure that they're safe if they're drinking. And then liver disease is obviously a lot of people know that liver disease is a common consequence of heavy alcohol use over time.
Right. I guess I'll pose this question to both of you. So we know that genetics play a part in how someone might have a future that involves a lot of alcohol consumption. So can you tell us about how to know if someone might be genetically predisposed to alcoholism?
Yeah, so statistics say that it's about 50% of alcoholism is genetic. So the best way to know that really is, looking at your immediate family, your mother, your father, grandfather, siblings. Are there people in your family that have alcohol use disorder or struggle with chemical dependency of any kind? That will put you at a higher risk for predisposition of alcohol use disorder. That's primary. There are some genetic tests that you can have done However, they are very expensive, and most insurances don't cover that testing. Other things that would predispose you are how you were raised, the environmental factors that you were exposed to as a child. There are different tests that can be done. One is called an ACE test that look at those different factors to determine if you are at higher risk for developing not only alcohol use disorder, but a chemical dependency disorder. I don't know if you have anything else to add to.
Oh, I think that's great. Yeah.
Okay. Shifting a little bit in what we're talking about, this might seem like a no-brainer, Dr. Thomas, but why is alcohol consumption not safe during pregnancy?
Yeah, it is something that a lot of people know, but I think a lot of people don't know the specifics about that. And opinion, throughout the years really shifts back and forth. So I'll start by saying that it's really hard to have good data on alcohol use in pregnancy because we can't run what we call a randomized controlled trial, which is the best type of evidence that we can have. Would be, to get the best data, we would give some pregnant women alcohol and give other pregnant women not give them alcohol and compare those two. But obviously, that's very unethical because we know that alcohol is bad for fetuses. So we don't have that type of data. So all we have is observational data where we interview pregnant women who admit to drinking, which is a lot of pregnant women who do drink, and a lot of people don't admit to it, and so it's difficult to study those situations. But what we do is we do our best to talk to women who are honest about their alcohol use during pregnancy and then examine the effects of their children as they grow up. But what we do know is that in early pregnancy, alcohol is associated with stillbirth or miscarriage. And then, throughout the pregnancy, any amount of alcohol use. This isn't like, more than one drink a day or whatever. This is any alcohol use is associated with reduced brain volume of the baby, the child. This affects the child's cognition, impulse control, judgment, emotional processing, memory, and learning as they're growing up. There's an increased risk of congenital heart disease in fetuses that are exposed to alcohol in utero. There's skeletal changes that you can see, including scoliosis, shortened fingers. There's facial features that are associated with what we call fetal alcohol spectrum disorder. We call this now. Kind of different facial features that can result in exposure to alcohol in utero. Kidney abnormalities, vision problems, and hearing loss are all effects of drinking during pregnancy. So it's really important that people know that there is no safe amount of alcohol in pregnancy, and the safest thing to do is to avoid it completely. I do get a lot of patients. I do a lot of prenatal care, and I get a lot of patients who have had drinks prior to realizing that they were pregnant. And I do try to reassure patients that prior to implantation, in the early stages of pregnancy, it does not seem to have a great effect on the fetus. Of course, it's important as soon as you know that you're pregnant to stop drinking. And the other thing to think about is that if you may become pregnant, if you're not using birth control and you're having sex, then you really should abstain from alcohol if you may become pregnant to avoid that situation where you're drinking before you know you're pregnant.
Okay, great. Thank you.
Yeah.
So we'll shift gears back. Wendy, can you tell us about treatment and how you approach treating someone with an alcohol abuse disorder?
Yeah, absolutely. I think the most important thing is to really give them some options that they have. Historically, people might have think that it's best just to abstain from alcohol altogether. However, that doesn't work for everyone. So it's important that we're open-minded to other treatment options. We do harm reduction, which is basically cutting down or limiting the amount of alcohol in combination with treatment services. Treatment can be going into a residential treatment center where they are there for anywhere from 30 days to 6 months in an inpatient facility, and then go to maybe an aftercare following that treatment, or maybe going to a sober living environment that offers them a little bit more support, which is good to see that treatment is extending a little bit beyond the traditional 28 days, because it does take time, first of all, to kind of normalize the brain's functions, like Dr. Thomas was talking about earlier, and find a different way of living. So it usually means that they have to change a lot of things in their lives, their family, relationships, the friends that they hang out with, some of the routine things that they would do. So just having compassion for that person, providing a lot of support for that person, frequent contact with that person, just let them know that, you're there for them. And checking in with them. There is also medications that are available that can help with some of the cravings that people would have as they're stopping the alcohol. We do a couple different medications. Most commonly, there's a camprosate, or naltrexone is the most common. And there is evidence that does decrease the cravings for alcohol use. As well as if somebody is stopping the alcohol use, we want to make sure it's safe to do so. And so there's some withdrawal medications that can be prescribed over, in an outpatient basis, or like previously said, it may require that they have a little bit more intensity of monitoring to be sure that they're safe in doing that.
Okay. I guess I would say, is it quote unquote curable, or can someone be quote unquote cured from alcohol abuse disorder? Is that possible?
I don't know that we look at alcoholism as a curable disease. I would like to say it's more like if you were diabetic and you need to take insulin or medication for that diabetes to keep it controlled and well maintenance. Same thing with alcoholism. It's important that they establish certain routines in their lives and seek the treatment that they need on an ongoing basis, and continue to have those supports and those mechanisms in their life to keep them in remission. So normally, alcoholism can have periods of relapse, just like diabetes or congestive heart failure or any of those other chronic conditions. So it is a lifelong disease, and it does require maintenance.
Okay, thank you. Dr. Thomas, let's say, you have a patient and they maybe aren't predisposed genetically, they are over the age of 21, and they do enjoy a drink from time to time. What would you recommend for someone to consume alcohol responsibly? What's that safe level of consumption?
So the kind of mutually agreed upon in the medical and addiction community is, for women, no more than 3 drinks in one day, and then no more than 7 in that week, and meeting both of those criteria. So, not more than 3 in one day, and that's for women and people 65 and older, and then for men, that would be no more than 4 drinks in one day, and no more than 14 in 1 week.
Okay.
It would be the recommended kind of safe amount of alcohol consumption.
Sure.
It is really important for you to talk to your doctor about your alcohol use. Your doctor's not going to judge you. Your doctor is especially most family doctors are well trained in alcohol use. Alcohol use is super common. 30% of people drink more than this in the United States. And so, we know that people are drinking more than that, and we're happy to talk about it. And we want you to bring it up. And we will ask, but sometimes people aren't always honest because they're afraid their doctor's going to judge them, or they're not going to be able to help them. But like Wendy said, it doesn't have to be, your doctor's not going to be like, you need to go to AA, or I'm going to admit you to the hospital. There are things we can do to help you reduce your alcohol to a safe amount. Or maybe it's the right choice for you to stop completely, in which case we can help you do that too. But yeah, it's just really important to talk to your doctor about it, and think about these limits. Be honest with yourself about how much you're drinking, how it makes you feel. And if you aren't comfortable with it, talk to your family and your doctor or your provider at Northpoint.
Okay, thank you. Wendy, can you talk to us about how to help someone with their dependency on alcohol? So if I know someone in my family, or I have a friend and I've noticed these signs that they might be abusing alcohol, but they aren't willing to have that conversation. It's a difficult situation. So, what are your recommendations for getting that person help?
Yeah, so alcoholism is a family disease. So it doesn't just affect the person who is consuming the amount of alcohol required to get the diagnosis. So I think it's important, first of all, to have compassion for that person, understand that it is a disease, that there is help out there for that person and for the family. And so, talking to the person is important, letting them know that you're concerned about their drinking. They may not be aware of the problem or that you are concerned. So I think first expressing that you have a concern for that person, providing love and support, maybe even sitting down together, and there's plenty of websites out there. SAMHSA is one of the main organizations that will list all the different places that you can get treatment, including Northpoint. There's a variety of different help out there, so it can be a phone call to somebody. There's helplines that are available 24/7 just to talk to somebody, and that's for the person who has alcohol use disorder or the family who may need some help in talking to their family and it's not going well. So these hotlines can help you in both of those ways, as well as suicide hotlines as well, if there are some mental health concerns that are involved with the person. It may be, volunteering to go with that person to the doctor to discuss their condition. It really depends. It's just being open-minded and really providing that love and support for that person and letting them know that you're in this with them and you're concerned for them and you'd like to see them get the help that they so well deserve. So,
Absolutely. Thank you.
you're welcome.
And on the other side, if someone personally needs information or help about maybe confronting their own alcohol use, Dr. Thomas, how would you suggest someone ask their primary care doctor about that?
I think being really straightforward is the best approach. I'm happy to have an appointment just about that, but also if you're going to say you want to come in for a physical, if you're, you don't want to, call the call center and say, I need an appointment for my alcohol abuse. You can just say physical or follow up, but you don't have to tell the phone person. You can wait until the doctor's in the room or the provider's in the room and say, well, this isn't really physical. I just want to talk about alcohol, and just be really straightforward with how you're feeling about it. And you can also ask your provider if you're worried about a family member, for example, and then in that moment we can give you more resources like the SAMHSA website or the AA website are good places for you to start and look at for yourself, and then just talk to us because we're here for you.
Absolutely.
There are support groups called Al-Anon that are also available for family to kind of help with some of the issues that surround that condition or family dynamic available.
And, we've mentioned this several times throughout the interview, but Northpoint has services to help with alcohol dependency as well as other chemical dependencies. And so maybe just one more plug from both of you about what you offer and what someone can look to Northpoint for help with.
Yeah, so our program here, whether it's alcohol use disorder or opiate use disorder, which are the most common that we typically see and have the most success in treatment. Here we do a comprehensive program, and so they will have a care coordinator, which would be myself, to help manage lifestyle changes, as well as look at other socioeconomic factors like housing or food or job resources, things of that nature. And then they'll have a primary care physician that they'll follow pretty closely to look at their physical health as well as their dependency. And then we also have our patients see behavioral health. And so we also want to make sure that any underlying mental health illness is being looked at and treated coinciding with the alcohol use disorder or chemical dependency treatment. And then we have dental here at the clinic as well. And so making sure that our oral health is up to date and taken care of. But I think overall, it's just a comprehensive program that provides a lot of support and a lot of different resources depending on the individual's needs.
And the great thing about Northpoint is that you don't have to have insurance to come here and get care. So if you're worried about accessing these services because you don't have insurance, then you don't need to worry about that, because we have lots of support for people without insurance, the sliding scale fee, and we can help you get signed up for insurance if you qualify for that.
Great. Thank you. Thank you so much. So Dr. Helen Thomas and Wendy Nelson from Northpoint Health and Wellness Center, thank you so much for talking to us about Alcohol Awareness Month. We're glad to have had our questions answered by two people who obviously know what they're talking about, but also care about who their patients are. So thank you for your time. We really appreciate it.
Thank you.
Yeah, our pleasure. Thank you.
Thank you. Thank you for listening to Northpoint, Making Health Happen. We want you to know that we are here to partner with you, that you can dream and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about Northpoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.